Welcome back. Since Mzulungile Ndikana was appointed the CEO of the South African Medical Association, there has been added interest in the progress made by South Africans who were part of the first group to study medicine in Cuba. A survey of graduates trained under the South African government's Cuban Medical Training Programme found that they showed stronger motivation for creativity and initiative in their careers, especially in rural areas. Bhekisisa Center for Health Journalism has tracked the progress of these doctors and the senior positions that they now occupy in various spheres. Let's now speak to senior profile writer Sean Christie, who's joining us this morning. Sean, a very good morning to you. Thank you so much for making time for us. Let's start off here. What sparked your interest to track down some of these doctors who graduated from this program?
Good morning, Alden. Good morning to your viewers. Thanks. Yeah, I interviewed a number of senior leaders in the healthcare sector in South Africa. And in this last year particularly, I was clocking that quite a number of them had cycled through that Cuba training program, which was a contrast, or it was a bit at odds with the narrative on that Cuba training program, which is often quite negative and critical. Yet here were these high achievers.
Yeah, and in your article also, one of the points that you raise is almost speaking to the contrast of all of this, is that you have the new CEO, of course, of the South African Medical Association, Mzulungile Ndikana, and you contrast that to the remarks that were made by Mark Sonderab, who was the vice chairperson of SAMA. I just quickly want to read it to our audience. Everybody agrees that we need more doctors. But is this the best we can do?
Yes. So that various people in doctors' associations have been critical. The Democratic Alliance is often given the government a hard time for the cost of the program. So that has been the narrative. And one of the other criticisms raised is that this is Cuba we're sending South Africans to. Could we not send them somewhere in Southern Africa or to a system a little bit more like ourselves, what we have here in South Africa? Those are some of the criticisms. But I think that one of the points that came through when I interviewed these leaders was that it was exactly the fact that the Cuban system is so different from ours that had given them an edge. It gives them a different perspective from what they would have had they come up in the South African system.
So in which form are they different to what we have in South Africa? And also the reference that is made around the conversation that took place between Nelson Mandela, I think as well as Fidel Castro, around how Cuba can assist South Africa. And the point that is also stressed is that South Africa needs to also create its own doctors.
I think it's useful to go back to the roots of this program. In the 90s, when the African National Congress took over, they inherited a very unequal health system that was very centralized in urban areas and very much facing towards certain demographics, the wealthy, and whites particularly. So there was a shortage of healthcare workers in rural areas, and to address that shortage, Mandela reached out to his friend Fidel Castro. Cuba has a renowned health system, and particularly an education system for feeding doctors and nurses into that health system. Castro sent doctors to South Africa, but said to Mandela, look, you're going to have to train your own doctors. And that's how this agreement to send South Africans from rural areas to Cuba came about. And the logic was this, that people from rural areas are more likely to go back to those areas and serve their communities. And in fact, research has since borne that out as being true. So that was the sort of roots of it. Now, Cuba's system differs from our system in that they emphasize the preventative aspect of medicine. working in communities, sharing information so that people understand the risks, the disease risks that they face, and can do something about it. In South Africa, we have a very curative emphasis. So I get sick, our system will help me in a hospital or a clinic. That's the essential difference.
Yeah, and in terms of the training, with Cuba, is it the government that actually funds the training for the doctors, or is it something similar to what we have here in South Africa, which almost sounds like it's a dual system, where in some parts you'd have some contribution that comes from the state, but most of all it comes from the individual?
So I can't speak to the specifics of the Cuban system. I just know that our Cuba trainees, the students we sent over, went to 5 different university campuses around Cuba. That the costs of that training were borne by the South African government. So effectively, they got 6 years of free education, 5 in Cuba and a finishing year back in South Africa. I think maybe one thing that's worth mentioning is that the Cuban education system is a little bit more in lockstep with the Cuban government's policies. In South Africa, our universities, and we have some excellent medical departments, I'm not disparaging those at all, but they are very independent of government policy. And this was one of the issues right at the outset, was that the government doesn't have the ability to train doctors. So if it's not happy with what the universities are putting out, it has a problem. And it looked to Cuba for a solution to that problem.
Yeah. Let's speak about some of the other candidates who went to Cuba, came back as doctors, as they call them, the one suitcase students. One of them is Nhlakanipho Gumede, who is a senior manager at Grace Hospital in Pietermaritzburg right now, and I understand the former CEO of the iconic Pholela Health Center. And he was, 16 at the time that he was selected to be part of this program and went to Cuba. Nearly missed his flight because he didn't have an ID or a passport.
Yes, Dr. Gumede is in fact running Grace Hospital at the moment as the acting CEO, but you correctly said he is employed as a senior manager. He's just one of these great stories. He comes from deepest rural KwaZulu-Natal. His occupation throughout school, he told me, was being part of a dancing troupe, and that was his ambition, was to become a professional entertainer. And then reality hit, the reality of how far he was from power and influence, and how limited his choices were. So. Were it not for this program, when he was accepted into the program, he was studying business administration at a free university in Johannesburg. So I think it's, his is he's a nice example of what South Africa would have lost had these opportunities not been available to the Dr. Gumedes of the world.
Yeah. And then there's, of course, Bongile Mabilane, who has now done or led 2 prominent research ethics committees for South Africa, with the Council for Scientific and Industrial Research and Human Research Council as well. And her story around how it was actually her mum who applied on her behalf.
Yes, I love Dr. Mabilane. As a journalist, you get some wooden interviewees and you get those who just amazingly open and natural, and she was the latter. She was a self-confessed rebel, a sort of ne'er-do-well, focused on material things, and she had very super religious parents in her home in Nelspruit, who at some point decided enough was enough, and they hauled her out of the campus where she was studying hotel management, and basically told her, "You are going to be a doctor. God has spoken to us." and they enrolled her in the Cuba training program. So she freely admits she has no agency whatsoever in getting to Cuba. But once she arrived in Cuba and she saw, her peers around her, who were these, these, I suppose, really striving, ambitious rural kids, she was very inspired, and in her words, she hit the books for the first time in her life, really. And it ended up being a top student, a top performer from that cohort. And when she came back to South Africa again, she finished her year at University of Pretoria with distinction. So another great sort of story, but slightly different. She was in her own words, the black sheep of that intake.
Yeah, and finally, in conclusion, Sean, do you think that a case study has been made, or case has been made out for why this program should be considered a success and why the government should continue with it? Also looking at the other end, the issue that you raised, that has been raised by the Democratic Alliance, is around the money that is spent on this program.
There are issues with this program. It's grown substantially since the early 2000s, where the intake was, a few dozen people, and at a point it was hundreds of students from per province going every year. And as you well know, there's a problem with job shortages in the public sector for doctors. So there's, in a way, there's now a slight misalignment. We've now got too many doctors, it would seem. So I think this is focusing on an aspect of the Cuba training program that hasn't really been examined, which is that it's produced some of the top leaders in healthcare currently, and that's all it was. It's not making an argument for the endless renewal of the program, because the context changes.
Yeah.
And there might be something more fitting in due course.
But do we know whether the Cuban doctors, with the aim around where the focus is on prevention and preventative measures, have been able to influence our health system when it comes to how we administer healthcare?
They've made some small but important differences in the rural contexts that they came back and worked in. They started. One doctor started an NGO, Dr. Madela, who's currently gone back to Cuba as our health attaché. And that NGO put tools in the hands of nurses in communities that really helped them to raise awareness around things like diabetes and hypertension. But I would say, if you're looking top line, there's a lot to do when it comes to disease prevention, and getting closer to a community oriented model of healthcare, sort of social healthcare model. South Africa has a long history of trying to do this, going back to the 1940s, and we get a bit better and then we fall back, and so we're certainly not there.